with you today about an issue that rises above partisanship, the well-being and dignity of the people of North Carolina. Thank you for being here, for your unwavering commitment to raising awareness about the serious impact of Medicaid and Medicare defunding in our state. These cuts will deeply affect working families, rural communities, seniors, people with disabilities, children, and countless North Carolinians. I am Representative Julia Greenfield, and I'm proud to be serving my first term in the North Carolina General Assembly. Before I entered elected office, I worked as an emergency medicine and trauma nurse. I saw firsthand what it means when people cannot access the care they need. Parents choosing between groceries and prescriptions, rural residents driving hours for basic treatment, seniors arriving too late to receive care because they couldn't afford it. I saw preventable tragedies, unnecessary pain, and devastating loss. Real lives, real heartbreak. Those experiences, among many others, are what led me to this work, because I came to understand a fundamental truth. Medicaid and Medicare are not just government programs. They are vital lifelines. For hundreds of thousands of people in North Carolina, they mean the difference between stability and hardship, between survival and suffering. For over a decade, North Carolina Democrats fought for something deeply personal: the right to health care for every North Carolinian. When former Governor Cooper signed Medicaid expansion into law in 2023, it saved lives and gave 650,000 people access to the care they were previously denied. But now that progress is under threat. We are facing a coordinated two-pronged attack on health care, one from Donald Trump's administration in Washington, and the other from Republican leadership right here in Raleigh. To fully understand the stakes, I want to address what is happening at the federal level. Donald Trump's so-called One Big Beautiful Bill, signed into law on July 4th, no less, and celebrated by MAGA Republicans, is in reality a dangerous, reckless, cruel attack on our healthcare system. This bill threatens everything we've worked for in North Carolina. It caps provider taxes and slashes federal matching funds, undermining the Health Care Access and Stabilization Program, which is the financial backbone of our Medicaid expansion. It strips over $1 trillion from Medicaid nationwide. It guts funding for children, people with disabilities, and seniors in nursing homes. It imposes harsh work requirements and bureaucratic red tape, not to improve the system or care, but to confuse and to throw people off coverage. And despite what Republicans claim, Medicare is not safe either. By adding $2.3 trillion to the federal deficit, this bill automatically triggers cuts, including nearly $500 billion from Medicare starting in 2026. That means lower provider payments, longer wait times, and fewer doctors willing to see Medicare patients because of reduced reimbursements. I can say with certainty, after having cared for Medicaid and Medicare patients during their most critical moments, these cuts will cost lives. And it doesn't stop there. More than 70% of the proposed Medicaid cuts target hospital funding, including a staggering $3.7 billion slashed from North Carolina's rural hospitals. These are the very hospitals that serve as lifelines for some of our most vulnerable communities. And if this bill is fully enacted, it will mean maternity wards shut down, cancer treatments closed, emergency rooms going dark, turning entire regions into medical deserts, where care is simply not available when needed most. These aren't hypotheticals. These are the real consequences for real people in our state. And we must also remember, Medicaid doesn't just provide health care. It also supports our local economies. Hospitals, clinics, long-term care facilities. They don't just treat patients, they provide good jobs. Estimates suggest this one big beautiful bill could eliminate 300 to 500,000 healthcare jobs nationwide, with a significant share lost right here in North Carolina. So we have to ask ourselves, why is this happening? I'll tell you why. It's to fund those massive tax breaks for billionaires and corporations. And because of that lost tax revenue, budget shortfalls will be created that must be offset. So Donald Trump's one big beautiful bill and his MAGA Republicans have decided these financial shortfalls will be paid for by ripping away health care from the sick, the elderly, children, and working families. It's a calculated giveaway to the very rich. And there is nothing beautiful about taking health care away from our most vulnerable. And here at the state level, right here in Raleigh, North Carolina Republicans are failing to do their job. To fund the Medicaid program they finally voted to expand in 2023. And I want to be really clear about this. Republicans control everything. They are in charge of the House, the Senate, and every committee. This is their failure to fund our health care. And we are just days away from devastating rate cuts to providers. Cuts that will go into effect October 1st, unless Republicans come to the table and fully fund our Medicaid rebase. And this crisis, entirely avoidable. Earlier this summer, we passed a modest bipartisan budget that included $600 million in Medicaid rebase funding, out of the $819 million that was requested and needed to prevent Medicaid cuts. It was a good faith down payment, but we all understood more funding would be required. Now, months later, Republican leadership still has not adequately funded the financial gap, even though the Department of Health and Human Services has made it crystal clear without the needed additional funding, provider rates will be slashed. So, why haven't Republicans acted? What is holding them back? They are playing politics. They want to score political points with Donald Trump. They failed to pass a comprehensive state budget, which was due on July 1st, nearly 3 months ago. And instead of prioritizing the health of North Carolinians, they're holding Medicaid funding hostage to push unrelated political agendas. The consequences of their actions or inaction are going to be devastating. There will be harm to hospitals already struggling to stay open. There will be pay cuts for doctors and nurses, delays in care, real people losing access to life-saving services. This isn't leadership. They are playing with our lives. And yes, people will die because of their failure to do what is right. So we must act, and we must act now. We must pass a clean bill to fully fund Medicaid and protect provider rates. My Democratic colleagues and I are ready. I'm asking my Republican colleagues to join us. We must reject Trump's federal attack on Medicaid and Medicare. We're ready. I'm asking Republicans to stand with us. We must continue defending the expansion we fought for that now covers over 650,000 North Carolinians. We are united. We need Republicans to unite with us. This moment demands courage, it demands action, and it demands accountability. And to the people of North Carolina, your voice matters. Your health should never, ever be a bargaining chip. Your well-being, your family's care, your community's future, none of it should be held hostage to garner favor from Donald Trump. We Democrats, we stand ready to work with our Republican colleagues because access to health care affects every family in this state. This isn't about party, it's about people's lives. And now is the moment. Now is the moment to come together and lead for the good of all North Carolinians. Thank you. Now it is my pleasure to introduce our next speaker, my colleague, Representative Rodney Pierce.
Thank you, Representative Greenfield. Good afternoon, and thank you all for being here. My name is Representative Rodney D. Pierce, and I proudly represent House District 27, which includes Halifax, Northampton, and Warren counties. I'm here today because we are standing on the edge of a cliff, and unless action is taken, our most vulnerable neighbors will be the ones pushed over. On October 1st, just days away, devastating Medicaid cuts will go into effect if the General Assembly fails to act on funding the Medicaid rebates. As Rep. Greenfield said, these are not abstract numbers in a budget spreadsheet. These are real people, real families, real consequences. In Halifax County, which is in District 27, 45% of our residents are enrolled in Medicaid. In Northampton County, it's 41%. In Warren, it's 35%. And who are these recipients? In District 27, the vast majority are women between the ages of 6 to 18. These are our babies, our children, not even fully grown, but are already facing the loss of critical health care access if we fail to act. Medicaid isn't just a policy for us in rural North Carolina, it's a lifeline. Rural residents often must travel long distances just to see a specialist, because in many cases, those services don't even exist where we live. And if these cuts go through, our rural hospitals, already operating on razor-thin margins, could be forced to shut their doors for good. What happens then? Patients in crisis will have to travel even farther. Ambulances will be stretched thin. Emergency rooms in surrounding counties will be overwhelmed with patients they were never built to handle. And it's not just hospitals. These cuts will hurt primary care providers, dentists, psychiatrists, and those who serve individuals with intellectual and developmental disabilities. Providers we desperately need in our rural communities may not be able to keep their doors open. All of this, as well as the cancellation of the Healthy Opportunities Pilot Program, can be avoided. As Representative Greenfield said, we stand ready to work with our Republican colleagues to fund the Medicaid rebates. We should not put our children, our hospitals, and our communities at risk. The deadline is October the 1st, and the time to act is now. Thank you. And now you will be hearing from my colleague, Representative Maria Savagna.
Good afternoon, everyone, and thank you for being here with us today. As my colleagues had said, in detail and in breadth, Medicaid is the backbone of health care for more than 2.8 million North Carolinians. Children, seniors, people with disabilities, and working families. Both as a legislator and a public health professional, I can attest that when we fund Medicaid properly, we improve outcomes across the entire population. We prevent disease, we manage chronic conditions, and we save lives, as my colleagues have said. We are here today because right now we are at a crossroads. We have taken the right steps in the right direction. I want to say and reiterate that we did pass a mini budget of $600 million in July. That included $600 million for Medicaid rebase. And that was, as my colleagues have said, a good faith effort with bipartisan support. And I do want to clarify, $500 million of that was going to go to Medicaid. But as it was mentioned earlier, the North Carolina Department of Health and Human Services requested a very clear amount. $819 million is needed to keep Medicaid solvent and maintain provider payments, coverage, and services statewide, with the demand to keep services equal or above at a higher level. And that means we're still facing a $319 million shortfall. I want to mention that we are working together. For the past several weeks, legislators from both parties, both chambers, have been trying diligently for a compromise. There is a shared recognition, after all the hard work that we did for Medicaid expansion, that we cannot let this program fail. But time, as it was mentioned, is running out. Without agreements across the board, provider rates will cut to 3% and will take effect on October 1st. When this cut happens, providers will be less compelled to serve our people who are in Medicaid care, and we can't afford that to happen either. So as asked to talk in specific about what this means in terms of health care. Those cuts, as it said, will impact hospitals, not only in the urban areas, but most significantly in the rural areas. Primary care physicians, like I say, would be less compelled to serve and less compelled to work here in North Carolina. Behavioral health providers, and I will just touch base on just that a little bit. And I urge the public and our media to look at some of the other bills that are coming up this week and how there is an attack on behavioral health and substance use care for our people in North Carolina. And many of our family and friends are elderly, and home health agencies already in a struggle, already that are having underserved, underworked people that are not being paid sufficient enough to care for our older population will get affected too. These are the very people that we rely on in our community to care for our loved ones and our families and our friends. From a public health perspective, the results are predictable. We don't need to do an ANOVA analysis or any biostatistician extensive research. Preventive care visits will go down, not only by the offering of services, but the compelling of people to want to go to that service. Chronic conditions like diabetes and heart disease, which are afflicting so many of us, not afflicting, but just day to day, are affecting so many of our people, will go unmanaged. And emergency departments will see more patients for issues that could have been treated earlier and more affordably in primary care settings. We can't just look at the surface area when it comes to this funding, because like I said, the more people go from primary to secondary to tertiary care, the costs of these things are exponential, not only for the individual, but for us who also pay for that, which are from our state funds. So we know what happens when access is disruptive. Also, infant mortality, maternal fatality, rural health disparities, as Representative Pierce had said, and life expectancy gaps between urban and rural areas will grow. These are not just numbers, like they said, on a spreadsheet. These are our neighbors, our friends, our loved ones, our community. So what is the path going forward? As all of us have said and probably will continue to say, Democrats are ready, and we are prepared to work with anyone, everyone, on either side of the aisle, on either chamber, to pass a clean Medicaid rebase bill and stabilize our Medicaid and healthcare system. Because not only when we defund or lessen the funding of Medicaid, it trickles down to even insured covered people and every other people underinsured. Every North Carolinian gets affected. Other policy debates should be addressed in a comprehensive budget package, but access to healthcare must not be held at an impasse due to politics. So in closing, this is about keeping North Carolinians healthy and our healthcare system strong. We know what we need to do. We know how much it's going to cost. And we know that doing nothing is going to hurt millions of people, and not only hurt them, but also affect their lives. So let's finish this job. We have already the work coming to this point, but let's keep working together to finish the job and ensure North Carolinians receive the care, the love, and the respect that they need when it comes to their lives. Thank you. And to close, we will have Representative Sarah Crawford.
Good afternoon, and thank you so much to my colleagues for the work that they have done and for the opportunity to speak today. I'm Sarah Crawford. I represent House District 66, and I also stand here today as the CEO of TLC, founded as Tammy Lynn Center for Developmental Disabilities, a nonprofit that's been serving North Carolinians with intellectual and developmental disabilities and their families for more than 50 years. At TLC, we work with some of the most vulnerable members of our community: infants and children with complex medical needs, adults with disabilities who need full-time support, and families who are doing everything they can to give their loved ones the best life possible. And today, we're all here to talk about Medicaid, not as a line item, but as the lifeline it is for families, providers, and workers across our state. Medicaid covers therapies for children, personal care for adults who cannot live independently, and supports families navigating an already incredibly complicated system. It also pays the wages of direct support professionals, nurses, and therapists who make this work possible. People who have chosen a calling, not just a job. But right now, that lifeline is under threat from both federal and state pressures. You heard a little bit from my colleague, Representative Greenfield, but at the federal level, Congress and President Trump passed a reconciliation law that restricts provider taxes, which North Carolina relies on to fund our share of Medicaid. It also imposes new work requirements, and without action from the General Assembly, over 670,000 North Carolinians who gained coverage through Medicaid expansion could lose it, which is why I filed, along with colleagues, House Bill 619, the Health Care Security Act, to remove the 90% trigger and protect expansion for the long haul. At the same time, as you've heard extensively, we face an even more immediate crisis here at the state level. The General Assembly appropriated $600 million for Medicaid back in July, but the Department of Health and Human Services estimated the actual need to be much higher. And without additional funding, across-the-board rate reductions will take effect October 1st, from 3% up to 10%. That means providers across North Carolina in just days from now, will be forced to cut services, discharge clients, and lay off staff. Families will lose access to care. Workers will lose jobs, and an already fragile system will be pushed past its breaking point. It simply is not fair to put providers and families in the middle of this uncertainty. They deserve clarity. They deserve protection. We cannot continue to ask those who deliver and depend on care to shoulder the consequences of budget shortfalls and failed negotiations. That is why the General Assembly must act this week to protect services. We are calling on legislative leaders to pass a clean Medicaid bill that funds the rebase, and we all stand ready to work towards that. Unfortunately, as we've already seen, the bill that the Senate has proposed and their proposed committee substitute is not a clean Medicaid bill. It includes other provisions which have not been agreed to by the House. And if an agreement is not reached this week, families and providers will be left exposed to destabilizing cuts beginning on October 1st. This is not about politics. It is about people. It is about protecting Medicaid services, protecting our families, protecting our children, and protecting the workforce that make care possible. At Tammy Lynn Center, I have seen firsthand the consequences when families lose access to services, the panic on parents' face when coverage is denied, and parents are panicking right now. Staff who leave this field because wages are too low and funding too uncertain, and the children who fall behind when they miss the interventions they need. I've also been able to see what happens when the system works, when a child takes their first steps, when an adult finds their voice or a new way to communicate, and when a family begins to feel hope again. And that's what we are fighting for today. This is about more than budgets. It's about values. We cannot, simply cannot, abandon the people who need us the most. We cannot stand by while progress is erased, and we cannot expect our direct care workforce to show up every day without showing up for them in return. We are all committed to working with our colleagues in the General Assembly, the House and Senate, on both sides of the aisle to act this week to pass a clean Medicaid bill to protect services and to keep North Carolina moving forward, not backward. Let's lead with compassion, let's govern with wisdom, and let's protect the dignity and future of every person in our care. Thank you very much, and we are happy to take questions at this time.
I'm curious how important you think this Medicaid issue will be in the 2026 elections, both legislatively here and in the congressional race.
Yeah, go ahead.
I think that this Medicaid issue is critically important. Medicaid impacts 3.1 million North Carolinians across the state, plus, our expansion population, which is incredibly vulnerable, particularly from the federal cuts that are going to be coming down over the next year to 2 years. And I think that we have a responsibility here in North Carolina. We certainly have a responsibility to pass a budget, which we have not done because Republican leaders cannot get on the same page about what budget priorities should be. And so I think that this Medicaid issue is critically important, not just because it's a campaign issue, but because it's about people's lives.
And I want to add, it was briefly mentioned, when we did a Medicaid expansion, we really did get a lot of support from our counties. And the three main issues that were identified that pushed Medicaid expansion over the edge was the economy and how it would help those communities, the jobs that it would generate, and also the number of people that it would help. So doing this cut, doing any effect on not only expansion or the base of Medicaid will impact the economy of North Carolina. And that needs to be stressed so much. as Representative Rodney Pierce had said, it's mostly going to affect our rural counties. Those jobs, those people's, those families' livelihood, we need to think about that.
Yeah, your colleagues on the right, at least earlier last month, that they were saying that they wanted to hear a little bit more from Washington as to what some of their movement was going to be, which would explain the pace or lack thereof for some of the decision making. How has that affected your position to how you all respond?
Well, I'll say my position is I don't agree with what's coming out of Washington, D.C., and it saddens me that our Republican leadership is in lockstep with Washington, D.C. For me, as a former nurse, a healthcare provider, and as someone who has now stepped into this role as an elected official to help every North Carolinian, I find what's coming out of Washington, D.C. to be very cruel. And I think we need to step away from that, and we need to think about what our priorities are as legislators, and that is to take care of North Carolinians. And that is what I plan to do.
In the press release about the new version of HB 562, they talked about addressing the Stein administration's politically motivated cuts to Medicaid provider rates. Could you speak to that reference to Governor Stein?
Yeah. We're all deciding who should take this question. So the administration has been put into a really tough position. The department requested June, as we headed into July, the department requested $819 million for Medicaid rebates. The General Assembly funded $600 million. DHHS took $500 million of that for rebates, $100 million for administration, and the difference really stemmed from what DHHS was estimating and what fiscal research here, nonpartisan staff was estimating what would be needed for Medicaid rebates. And so this is not Governor Stein's cuts. This is an administration that was put in an incredibly challenging position because Medicaid was not funded at the request that was given to the General Assembly. It is also a reflection of the fact that not us, but that Republican leaders have failed to reach a full budget compromise and pass a state budget.
And if push comes to shove, will you guys consider voting for this new House bill?
So my understanding right now, so House Bill 562, which went through appropriations, I believe, earlier this afternoon, and is expected to be heard on the Senate floor, includes the $690 million total for the Medicaid rebates, plus some additional things that the House has not agreed to, which includes $100 million for the Children's Hospital. What we are asking for in the House is a clean Medicaid bill that gets at least that minimum funding, $690 million, which both Governor Stein and the Secretary have indicated they can work with that and get to the end of the year and make some reassessments about additional funding that will be needed after we get 6 months into the year. So, I can't speak for my colleagues here, but if we see a clean Medicaid bill, I will be very interested in supporting that because providers cannot sustain these cuts.
And I just wanted to add, and Representative Jones, you can speak to this as well, probably. This is a National Prostate Cancer Awareness Month. So to be having this debate, during a month when we're trying to raise awareness about the cancer that is the most common among men in North Carolina, particularly among African American men, it just makes you wonder and makes you think. Some of the words that have been used today are cruel, disappointing, discouraging, and when we have a month that's actually dedicated to a healthcare issue, and we're still debating, about making sure that our people are taken care of in terms of our constituents and just North Carolinians in general, it just really makes you think, what are we really doing? If we're not here to do our jobs and to take care of the people that we've been elected to serve, then what are we really doing?
I just want to say a couple things. When I came here, my name is Abe Jones. I represent District 38, which is here in Wake County. I came to support my colleagues, so I came and stuck my head in the door. But I will say this about the prostate cancer issue. It affects African American men deeply and disproportionately. And this is something that we need to continue to attack and get straight, because we're literally saving people's lives. So we got to do that. And then the other thing I just want to say, the overall healthcare issue. We should be able to put aside partisan differences and get this Medicaid thing solved. These are real people in real places who are going to suffer. Not so much in these urban areas like where I am, but you go out to where Rodney is, you go out where other people are in the rural areas, it's going to hurt a lot. And it's not abstract, it's direct, and it's something we can do. We're that close. Just have to close in on it. And I was so happy, we all were in 2023 when Donnie Lambert, the man, got that bill passed. It was bipartisan. I'm proud of this legislature, and we thought we had done it. And lo and behold, cruelly, the federal government pulled the rug out from citizens, red and yellow, black and white, all parties. That's a cruel thing that they did. And we have to make it up. All 50 states have to make it up. They cut it and ducked and ran and put the problem down to us. Well, we have to solve it in this legislature for the citizens of North Carolina. Thank you.
Any other questions?
Thank you.
Thank you. Thank you
Thanks
so
all for
much
being
for
here.
coming. We so appreciate you. Thank you.